electroconvulsive therapy. That is what I decided to do my project on. But before we can actually discuss what electroconvulsive therapy is, I'm going to want to talk to you guys about more critical issues that it helps solve so that when we do talk about electroconvulsive therapy, you know exactly what is happening. So, there are a lot of health issues that happen in the brain, and luckily, electroconvulsive therapy can help deal with those. Um, some in specific are the really big ones, such as severe depression, mania, schizophrenia, bipolar disorder, and psychosis. Now, all of the diseases that I just mentioned are very widely known by everyone to be very bad diseases. Because one thing that all of these diseases share in common is that their symptoms get progressively worse as time goes on. And unfortunately, as symptoms start to get worse and as the patient's condition worsens, that patient begins to become a risk to either themselves or other people. At this point, very extreme treatments will be necessary to keep them safe from not only themselves, but from other people who may want to abuse the fact that they cannot help themselves. But before we talk about ECT, let's get a little into the history of electroconvulsive therapy. To begin, back in 1935, a man named Lugislao Merduna had noticed a neat little condition in his patients where patients with both epilepsy and psychotic diseases would experience psychotic relief following an epileptic seizure. Now, he would proceed to test this extensively using a drug named cardiazol, which would spur brain convulsions similar to that caused by epilepsy. So it would cause an artificial seizure in your brain. Now, in the upcoming years, 1938, our big man Ugo Cerleri and his little assistant Lucio Bini decided to take this a bit further and would end up developing what would be considered a modern day, not a modern day, but like a primitive ECT procedure. Following their work, it would eventually become a modern day ECT with much more refined and less barbaric methods. Now that we know the history and what it can help with, now we can actually understand what ECT really is. So, electroconvulsive therapy is, you probably have an already good idea of it now. It's an artificially induced brain seizure to help relieve psychotic symptoms of a multitude of diseases. Now, it is very effective in what it does. However, it does have an extremely high remission rate, or it says medium, but in reality, it's a yikes. Now, we don't really know how it works. There are a couple working theories, but there is no widely accepted theory by all physicians. Some of the working theories include that the burst of electricity will actually affect neurotransmitters in the brain, so it'll affect how your brain works or processes. And another theory includes that the burst of electricities will actually change the neuroplasticity of your brain, which is your brain's ability to form and recognize new synaptic connections. And that brings us to our next topic. What does it do? Okay, since we don't understand it, how can we understand that it is good for us and that we know it is in fact effective? Well, let me tell you what it do. It's gonna treat a huge slew of neurological diseases. I've already gone through what these are, but if you want, I'll read you another list. It's major depression, bipolar disorder, schizophrenia, mania, all that jazz. But the issue is, this is not a widely available treatment. You cannot go up to your doctor and talk to him about ECT like you would about Advil or something like that. In order to qualify to be treated for ECT, you first have to receive a physician's confirmation that you are in fact eligible for this kind of treatment. Not eligible as in the fact that you have to sign a list and then get lucky that they pick you. More eligible as in all other treatments have failed on you. You have taken lots of pills and they don't work. You've gone to a therapist, you've done physical therapy, it does not work, and you're still very depressed. Once you get that confirmation, you can begin to start the process for this, because it's not actually just physician's confirmation. You have to do a physical as well, but we'll get into that a little down the road. Let's just jump back into what it does. What it does is it does not cure your disease. It will not cure your schizophrenia. It will not make you happy again after your wife has left you. What it will do is it will treat the symptoms that comes along with any disease that you may have. As we discussed before, it has an extremely high remission rate, but it is very, very efficient at what it does. It has roughly, this is going to come up later, a 50 to 90% remission rate when you stop taking the procedures. That is very high, and that is very bad, but it is very efficient at what it does. It will make you not sad. And let's proceed into when it works best. It is extremely effective on young children going up to young adults. This is because during this stage of human development, the brain will still be developing. And because this procedure uses the brain and it capitalizes off changes in the brain, it will come out to be very effective, and it will very much treat pretty much anything you throw at it. Now, just because it's more effective on young children does not mean it disqualifies old people from being able to receive treatment. In fact, old people will actually need to receive different procedures for the treatment in order for it to reach the same efficacy as a young child taking the procedure would. A young adult would only need to receive so and so volts, while an older person for the same treatment for the same disease would need to receive a significantly higher voltage and may also need more sessions in order to get the same level of treatment as the other kid. Now, once again, treatment is not end all be all. You take this zap for 2 weeks and then you're done, you're not depressed anymore. It very much depends on what kind of disease is getting treated. For certain things such as melancholic depression, malignant catatonia, and delirious mania, it'll all be gone within 2 to 3 weeks. And even though it will be gone in 2 to 3 weeks, you're going to need to come back. You will need to do multiple sessions. This is a lifelong thing in order to maintain those symptoms down, because it will come back. The worst part about this treatment, it has a very, very high remission rate. Now, fortunately, a very high remission rate comes with a benefit. It is very good at what it does. It will deal with psychosis and depression, but because treatment is different for each disease, remission rates will also be different for each disease. The remission rate for depression may be 50 to 90%, but the remission rate for a patient with an even more disease such as, or even more severe disease such as psychosis may even be higher. Now, that doesn't end hope, because once again, like I said, this is a very efficient treatment. Diseases such as schizophrenia and even psychotic mood states, once they get multiple treatments going, once they have a scheduled plan for it, they tend to be fully relieved within a full treatment cycle, which is 3 to 4 months. Overactivity of delirious mania, rapid cycling mania, and mixed affective states are also very quickly reduced, although unlike the others, they are not completely relieved. They are not completely done. Similarly, motor disorders, malignant catatonia, retarded catatonia, Benyan stupor, and neuroleptic malignant syndrome are all rapidly dissipated. Now, let's begin with the procedure. To begin with treatment, first, the patient will need to be asleep. This is one of the new inventions of the modern process. Before, all of the imagery that comes from ECT, when you hear of ECT, it's been largely conflicted as torture. This is because, well, the patients are awake when they do it. That is no longer the case. Patients are given an anesthetic injection, first to make them unconscious, to ensure that they don't feel anything mentally so that they're completely asleep. And then they're given further injection to ensure that the muscles themselves are fully relaxed and that when the seizure is occurring, the muscles will not spasm. In order to get the proper electricity flowing where you want it, doctors use electrodes, which are small pads that conduct electricity connected to a battery or whatever volt current generator they're using. and they place one on both temples of the head, or they can place one temple and one on the back of the head, or they can place one on top of the head and then on the side of the head. All of these have varying results on the efficiency of the treatment, but they will still treat the person's disease. They will not compromise the integrity of the treatment. Now, because of the injections, all of the muscles are completely relaxed when electricity does start flowing and when the brain does start convulsing. Thus, the patient will just lie there. They will start seizing, but not seizing. Their brain will experience the full convulsion, but their body will not be convulsing. Fortunately, the doctors don't have to hold you down, and because of that, treatments can be given very quickly and very efficiently. In order for a full treatment cycle to commence, you need to have roughly 6 to 8 total shocks across the span of 2 to 3 weeks, which is a month. So that is 6 to 8 shocks distributed throughout a month to complete a full cycle, plus whatever for a treatment plan. This is where the electrode's placed, if you didn't look at me. Now for the procedure details. The procedure is given inside of a hospital, if you couldn't already guess. It is typically given in the psychiatric ward of a hospital, or it's given in a hospital that specializes in mental health. Now, typically, this is after the procedure is completed or before if the patient isn't feeling up to it. Medicine is given to help with nausea, to help with headaches, vomiting, anything that could compromise the integrity of the procedure. And rather than the rescheduling, because this is a scheduled thing, doctors will try to remedy anything that prevents them from doing the procedure. Now, modern day ECT uses a relatively new method called brief pulse. Brief pulse it's exactly what it sounds like. It's brief pulses with significant pauses in between of electricity going into the brain. The electrode spurts electricity, and then there's a rest, and then it spurts again, and then there's a rest, and then it does that for the full treatment, and then you're done, you wake up, and then treatment's over. This is contrary to the older technique, which was considered not as effective and actually kind of harmful for the patient. It was called sinusoidal wave or sine wave pulse, where rather than brief pauses, it was straight electricity the entire time until treatment ends. This was less efficient. It's actually worse for the patient because it would induce the side effects of ECT much stronger, and it would do it with more consistency. You would consistently get headaches. You would consistently lose your short-term memory. And finally, the procedure is done in these hospitals by a full team because there are multiple parts that need to be done for this procedure. It usually consists of at least one anesthetist, one psychiatrist, and either a nurse psychiatrist or a physician assistant. Now, before the procedure, certain things need to be done. As already discussed, there are a couple physicals or a couple evaluations that you must complete before you become eligible for this procedure. First, you need to complete a psychic evaluation by someone of appropriate status to determine whether you are actually eligible for this procedure, like as if this procedure would actually treat you or if it wouldn't do anything at all. And alongside with that, there are a couple dangers that come along with doing this procedure, so you actually need to get a physician completed by a cardiologist to ensure that nothing funky happens during the procedure. And well, it doesn't consist of much. The only things that the physician or the cardiologist will measure is they'll do a blood test on you. They'll do a simple physical on you to see how your physical status is, and they'll see how your heart beats. They'll do an EKG on you, and they'll see if anything's normal with that, because we will cover this more detail later. An EKG is very important to prepare for this. Following that, you will need to sign a consent form for this procedure. If you are not of sound mind, you need someone else to sign it for you, but a doctor cannot legally give you this treatment if they think it's necessary unless you have verbally given an informed consent form to the hospital giving you the procedure. And once both of those things are done, you are ready for procedure. The pre-operation procedures will apply more to the doctors than you, because at this point in the procedure, you will actually be asleep. You'll be sleeping tight, dreaming about sheep, and the doctors will be the ones around you getting everything prepared. First, there are 3 stages to the pre-operation for ECT, and they all deal with getting the patient prepared with the anesthesiology, because it is very important that you do not feel anything and that your body does not convulse during this process, because that is a point of risk for bodily harm or for even the harm of other people in that room with you. Those 3 things include the proper anesthesia induction done by the anesthesiologist. That is to ensure that your body is actually receiving the anesthetic properly and that your brain will fall asleep so that you become unconscious. The second thing is also to do with the anesthesiologist. It will be the sleeping of your muscles. It will be the relaxation of your muscles with further anesthetist injection to ensure that your physical body will not convulse while your brain does. And the third thing is, since your body itself is relaxed and you are no longer controlling your own breathing, the doctors will have to have a system set up to control your breathing for you. That is, again, to ensure the safety of the patient. It'd be a shame if you just stopped breathing and died. Now, due to changes in autonomy, because your body is now asleep and your body will not control things for you, doctors will occasionally have to take control and start giving out medication. Not giving out medication, but giving you medication to help control your heartbeat, your blood pressure, and your heart rhythm. Now, a procedure can't be this good without dangers. These dangers begin with a very intense parasympathetic nervous system reaction. What your parasympathetic nervous system is it controls when your body enters a rest state. It will lower your blood pressure and it will lower your heart rate significantly to signify to your body that you are resting, things are okay, everything's going to be all right. Following this, your heart will experience a very brief asystole, which is a flat line, so your heart will completely stop beating. And then it'll start beating again. Your body will experience the opposite of a parasympathetic nervous system reaction, whatever. It will actually experience a sympathetic nervous system reaction, which is the opposite. It will put your body into the stress mode. Your body will start panicking. Your heart rate will spike. Your blood pressure will spike. Now, because of this, there is an extreme amount of strain put onto your heart. The rapid increase in blood pressure and in your heart rate because of this will actually increase your myocardial oxygen consumption. This entire process of events is recordable, and it is seen quite consistently on an EKG graph where ventricular and atrial beats are consistently premature, and the ST and T waves on an EKG graph will be showing premature gaps, and it will show irregularities during this process. These irregularities can actually be attributed to brief ischemia, which is when your body does not get enough blood, so it cannot oxygenate itself, so it starts slowing down and damage may start occurring. Now, that is not to say this is a prominent danger in the process. Cardiac complications are actually quite uncommon, but they are something to keep in mind. That is actually the reason why you need a cardiologist to give you a physical before proceeding with this procedure. To continue with the dangers, it is widely accepted that this procedure can actually cause changes in your brain structure. These changes include an enlarged hippocampus volume, which is a significant increase in its volume, upwards of 4 to 5%, alongside an enlarged amygdala and an increased integrity of the white matter tract in the frontal lobe. Now, fortunately, these changes are not actually quite serious, or at least we don't know yet that they're quite serious. No long-term changes to brain function have occurred or have been measured to occur because of these changes, and best of all, these changes will not actually affect the outcome of clinical trials and treatment. Now, to begin with the procedure, you'll need a slew of equipment. These include, but are not limited to, electrodes to transfer electricity, intermittent O2 to keep the patient alive, a stretcher to maintain the patient on, a blood pressure monitor, which is also called VAT, if you can read that, an ECG and an ECT voltage monitoring equipment, an intubation set to properly administer all the anesthesia, and a pulse oximeter to ensure that blood levels inside the body and its oxygen levels are fine. Now, let's discuss how effective this treatment is. Treatment is occasionally followed by a slew of side effects. Many of these side effects are very soft side effects. They do not affect your everyday life, and they all actually subside very quickly following treatment. Not quickly as in hours, but rather a day or two max. They will absolutely all be done by the time your next treatment comes. These side effects actually include poor memory, confusion, nausea, panic, and headaches. Now, that's not to say that every single person will experience treatment the same. Unfortunately, even though depression is very, very effectively treated, it can take upwards of 12 treatments to completely treat all the symptoms of a patient. Now, let's get into personal experiences. What does it feel like? This procedure, we've already discussed it before, it involves anesthesia, which puts you out cold. You will not feel anything. You will feel maybe the drug's effect on you, but that is the extent, the full extent of anything you feel. So yeah, you go to sleep and you wake up, and that is all you personally will feel about the treatment. Now, that's not to say you're not going to feel anything. You're not going to feel stressed out about this. You're not going to panic at the idea of, oh God, they're going to put me into a seizure. Because you probably will. This is a very extreme procedure. And especially with all the stigma surrounding it due to media. But doctors are smart. They've come up with ways to prepare a patient for this procedure. And those ways include giving them a step-by-step run on the procedure, exactly what they are going to do. They will actually go ahead and show a video of them performing the procedure to other patients to prepare the patient for what exactly they're going to do. It's fortunately very non-intrusive, so they can show patients as much as they want and nothing bad could come of it. For patients with extreme fear of this procedure, sometimes they'll bring in previous patients to help discuss what exactly it feels like, what exactly will happen after, if there's any reason to be afraid about going through this procedure. And a fun little tidbit, the biggest proponents of ECT are actually patients that have already gone through the procedure themselves. This is not because it's some miracle procedure, but actually because it is. Because they put you to sleep, you don't feel anything, and when you wake up, you actually feel significantly better. You won't have your psychotic symptoms, you won't have your hallucinations. It is an extremely enlightening experience, to say the least, for any patient going through this procedure. Now, do I recommend it? Yes. It is extremely, not cheap, but it is extremely available to people that do need it. It is completely non-invasive, and it is very quick and easy to schedule. You go in there, you nap, they do it, and then you're out of there very fast. You just do that a couple times a month, and you are completely relieved of any symptom you have. Now, to end it all, ECT is extremely effective, very safe, and available. It is a very reliable last measure for anyone who can't properly get treated for this disorder that they may have. Unfortunately, it will not cure your depression, although it will in the short term. Symptoms will always return. It has an extremely high remission rate, and it can only treat symptoms for as long as you actually take the procedure for. Now, while we still don't know how exactly it works, it is a very effective procedure, and it is very good at what it does. And in the end, it's just a great treatment option for those that have it available to them. The end. You want to see my references?
I kind of do want to see your references, bro. Thank you. Very, very clean. Very good
That's my
presentation. If you guys liked Oscar's presentation, be sure to tell him. Yeah, I think that's all we got. Bye.